My name is Stanley Savic. I live in Naples, Florida. I am a retired medical physicist who worked in the radiology department of a major Chicago area university for approximately 20 years, doing research on radiation treatment planning for cancer patients and other research with radiation machines. I developed pancreatic cancer in 2019, and I have been basically managing it with the radiation therapy for 1 week a couple of years back, and then chemotherapy using basically 5-FU type medication that I respond to very well. Although my cancer has not disappeared, it is pretty much contained in a cocoon-like. It's smaller than the original size of a golf ball, maybe half that size now. And my cancer has never bothered me. In 2019, when I discovered it, I developed a stomach pain. 1 or 2 days, it was pretty strong, so I went to a doctor. And from that point on, they did the tumor markers. They were as high as 11,000, and the normal range is from 0 to 49. So you can imagine that it was way up. And as I was diagnosed with adenocarcinoma in the pancreas, I started getting chemotherapy. I'm responding well, but my problem is that the chemotherapy has developed a severe neuropathy. I have seen neurologists, and they tested me with electric testing. They call it EMG, and it was diagnosed as severe neuropathy. I have been getting 1,800 milligrams of gabapentin in two 900 milligram doses of 3 pills per morning and 3 pills in the evening. And I, for a while, went to a 2,700, which is the maximum gabapentin allowed dose or recommended dose. And it didn't really make me feel any better. I'm not sure that it helps much. Perhaps reduces a little bit of tingling and tremor that I feel around my lips when I have chemotherapy. For a couple of days, as I get the chemotherapy and the pump that I have to carry for 46 hours afterwards, I develop the neuropathy feeling in my lips, and then it goes away. I'm not sure whether that's because of gabapentin or just because the chemical is leaving my body, of course, after the 46 hours. One of the things that I noticed is that I do not feel the feeling that an animal is biting my foot during the night under the cover, which is what it feels like when it attacks me. For about 2 or 3 times a night, I get that feeling, and then it goes away. I don't get that feeling during the day, but only at night while I'm laying in bed with my feet covered. Even the neuropathy doesn't bother me as much. That numbness and tingling is not bad enough that I would say that it's affecting my life. Even though I cannot pick up things with my fingers, I don't feel them, and I drop lots of things, and I cannot make little tiny adjustments. So I cannot wind my watch that still has a spring winding. It's a Momento watch for me because it's the watch that the astronauts carry to the moon, Omega Speedmaster watch, which is a memento and a souvenir for me from a pilot, best friend of mine. Anyway, the neuropathy is affecting my stability. It's giving me a feeling that I'm walking on clouds, and walking on balloons full of water or air, and I'm afraid I'm going to fall. So after using the cane for a while, I went to a walker, and now I'm using a walker. Since I started using neuro massagers on my feet, I have basically lost the feeling that somebody's biting in my foot during the night. So that's a good thing right there. I have only been using the neuro for about a month or slightly less, and I noticed that I can walk throughout my house basically without the walker now, without touching and holding onto the walls or chairs for distances of 10, 15 feet, which I really couldn't do a month ago. And I've looked at my iPhone statistics regarding the stability of my walk, and I have taken a screenshot which basically shows that my steadiness has improved, and I would like to attach that to this video, but I'm not sure that I know how. So if you at Noro sense that you get this message, and you can somehow tell me how to upload that photograph, it shows clearly that my stability, walking stability, is improving over the past month. As a suggestion for the future modification to your device, I would suggest that you include raised buttons, the 3 buttons on the back of the unit that control it, to be raised so that a person with poor visibility or a person that puts it on their own back or shoulder and is trying to activate it and adjust the mode and the intensity and so on, that can feel maybe and orient themselves as to whether they're on the on button, off button, or even more importantly on the mode button, because it's so easy to change the mode. And I like to use it in the mode that's called lymph drain mode, because it gives me the right massage and I feel it's good for circulation in my feet. Or alternatively, instead of just raising the buttons so that one can say, okay, this is number 1 and this is a blank space between on and off, if you put like 1 bump on and off and 2 bumps on an off button, and maybe 3 buttons on the 3 bumps on the mode button, that might help us when we cannot see the control. I can see the control on my feet, but sometimes I use the massager on my shoulder muscle, shoulder blade, and I cannot see it. So I have to basically guess at what it is. And if I take the unit off to program it and then put it on the shoulder, it really doesn't like to work that way because it likes to have contact with the skin as it is being programmed. So anyway, that's my video, and I like the device and I'm going to use it. Thank you.